vaccine to prevent this particular disease?
So till now, so there is no vaccine has been developed. So the antibiotics are effective. So antibiotics are given in two phases. There is something called acute phase treatment, and there is something called eradication phase treatment. For that, the doctor will ensure that after completion of the eradication phase treatment, the patient the recurrence will not be there to the patient. So the infection will be treated in the two manner. Acute phase treatment will be targeted minimum for 2 weeks. Your acute phase during the acute phase, antibiotic will be given by the intravascular route, and after the acute phase, in some of the patients, acute phase treatment may be extended for 8 weeks. And after acute phase treatment is over, then the eradication phase treatment will start. So their antibiotic will be given orally, minimum for 3 months. It will be given. In some patients, it may be given for 6 months, and in some patients, lifelong eradication phase may need to be continued. So this we need to understand, because the treatment regime is totally different from other bacterial infections. So because of that reason, the high degree of clinical suspicion should be there. So because of that reason, we are here to create awareness among the general public. We are here to create the awareness among the healthcare people regarding the signs and symptoms. And जब चाहिँ patient चाहिँ क्लिनिसियनकोमा जानुहुन्छ त्यतिखेर चाहिँ रिस्क फ्याक्टरको पनि हिस्ट्री लिनुपर्छ, लाइक पेसेन्टलाई डायबिटिज छ कि छैन, क्रोनिक रेनल फेलियर छ कि छैन, लिभर डिजिज छ कि छैन, क्रोनिक लङ डिजिज छ कि छैन, एन्ड इन्भाइरोमेन्टल हिस्ट्री लाइक एक्सपोजर टु सोइल छ कि छैन, गार्डनिङ हिस्ट्री छ कि छैन, फार्मर्स हुनुहुन्छ कि हुनुहुँदैन, सो पानीको ड्युरेसन, पानी परेको रेनी सिजनमा गएर बारीमा काम गर्नुभएको छ कि छैन. सो दिज अल आर द इन्भाइरोमेन्टल रिस्क फ्याक्टर्स. सो क्लिनिसियनले हिस्ट्री लिँदाखेरि, so all this history, environmental history, and then the patient ko risk factor will be taken, so that this will help in the coming to the diagnosis. इन्फेक्सन चाहिँ तपाईँलाई कस्तो छ, यो ब्याक्टेरिया तपाईँको सोइलमा छ, माटोमा छ हैन सर. सो सबै ठाउँको माटोमा ब्याक्टेरिया छ भन्ने छैन. कुनै ठाउँको माटोमा ब्याक्टेरिया छ, कुनै ठाउँको माटोमा ब्याक्टेरिया छैन. तपाईँको ट्रपिकल एन्ड सब ट्रपिकल डिजिजेस, मेनी ट्रपिकल एन्ड सब ट्रपिकल डिजिजेस अफ मेनी कन्ट्री दे हेभ रिपोर्टेड प्रेजेन्स अफ बर्कोलेरा सुडोमाली इन द सोइल, माटोमा. एन्ड बर्कोलेरा सुडोमाली यो ब्याक्टेरिया माटोमा छ भने चाहिँ हाम्रो ह्युमन बडीमा कसरी घुस्छ भने चाहिँ स्किनबाट, स्किनमा घाउ छ भने स्किनबाट घुस्न सक्छ. अनि तपाईँको सास फेर्दाखेरि, लाइक त्यही भन्छ हामीले रेनी सिजनमा चाहिँ माटोमा भएको ब्याक्टेरिया चाहिँ एरोसोलाइज हुन्छ. सो त्यसले हामीले इनहेल गरेर रेस्पिरेटरी रुटबाट भित्र पस्न सक्छ. और हामीले अनट्रिटेड वाटर खाँदाखेरि थ्रु ओरल रुट, थ्रु कन्जम्पसन अफ अनट्रिटेड वाटर अल्सो, या इट क्यान एन्टर.
As you said earlier, the treatment is available in CHC, CRH Manipal, right? So, is there any treatment available in government hospitals in Sikkim if diagnosed? If not, how will the
Yeah, actually for this normal antibiotic, कुनै sophisticated antibiotic होइन, normal antibiotic जुन चाहिँ ग्राम नेगेटिभ बेसिलालाई काम गर्छ त्यही नै चलाउँछ. Only difference चाहिँ duration लामो छ, dose फरक छ, त्यति मात्रै difference.
This antibiotic is available. It's a general antibiotic. It's the same antibiotic which is available everywhere. Only thing is, the thing is, you should know which antibiotics to be used. Everything is available. Everything is available. It's not.
So the antibiotic can be administered in any of the
Any hospital. This antibiotic is used by all doctors at all levels, even PHCs or primary care centers everywhere. The only thing is, you should know which antibiotics to be used. We may be using the other antibiotic. There are different types of antibiotics. So it is available. All doctors can administer this at all levels. It is nothing special, which is not a different antibiotic which cannot be administered at lower levels or government or private. It's nothing like that. The only thing is, diagnostic facilities available here.
So what are the charges for this?
What is the charge?
Charges?
Yeah,
actually for this project, so when we get the sample for the routine investigation, for the routine investigation, as usual the patient will pay, because in the routine investigation we use the automated system, whereas in the Burkholderia pseudomallei we diagnose the case by the conventional method, and when we need to repeat the sample from the suspected cases, in that case, we do not charge to the patient.
How much is the charge?
Normal routine charge, 500 rupees per sample.
So it is normal charges, as madam is saying. It's
So what are the precautions we can take?
yeah, we have made a brochure, which is like a patient information brochure. So which we have given to all of you also. I would be happy if you can, when you cover this press conference, if you can publish this also. It will be very useful to everybody. So every details are there in this particular brochure.
So what is the method of extracting the reports that implications are there or not? Is it being under-reported in the society where? What is the method going on?
So actually, in the project, inclusion criteria has been laid down. Means how which patient are we supposed to recruit in the study. So as per the inclusion criteria, like community acquired pneumonia, community acquired sepsis, abscess in the internal organ, bone infection, joint infection, skin infection, on-healed ulcer. So those are the inclusion criteria. Based on the inclusion criteria laid down in the project, the patient has been recruited. So till now we have recruited 145 cases in the project, and till now we have processed
That is
all the
almost same,
samples
a different
as per the
probe.
protocol laid
Different
down,
probe
and
is
we have
required
not
for
rejected
sortation.
any sample. And another thing is that in the project, twice in a year, there will be the external quality control. The lab will be assessed for the quality checking will be there. So when we send the sample for the reference center, all our report is for 100% confidence.
The method is almost similar to diagnose any other bacteria. Only thing is you need a different probe for this particular bacteria. That's all. That's the method is same.
Thank you.